Let me plug my computer up. Case my battery go dead. Should have did it with my iPad.
We will be recording, and I think we just turned it on. So, it's getting close to 7. So, yeah. So I want to make sure everybody's aware of that.
Okay, that's fine. I just can't get my camera on. That's all.
She missed it. Yeah, she wasn't feeling no, she's not the camera. You said it, Muscles. What do you say, George? Ready for a night on the town? Well, what are we waiting for?
How you doing, Miss Stevens?
What's that? I'm in. Oh, and I'm not muted.
That's the best thing to do. Now he's displeased.
Please, everyone, please mute yourself.
This place is really sweating. I'll put some more dancing, Muscles. Night is still young.
Okay, so I just got to add. Could I get everyone to mute especially if they got background music?
Grab your ticket and take a seat. All the things you love. Movies with high-flying adventures. Movies that are action-packed. And of course, okay. Looks like we got
I muted everyone. So what we'll do is as people speak, you can unmute, but I muted everyone so we don't hear all the background noise. Okay.
Hey, Lawrence.
Hey, how you doing, Gil? We're gonna get started pretty soon here.
Okay.
And I want everybody to be aware of the fact that we are recording. So and then everybody is muted unless you're speaking.
Okay, I'll go back on mute. Thanks.
No, you're fine. But yeah,
okay.
We'll go back right now.
Lawrence, something's hanging in front of your screen.
Oh, I'm sorry.
Like a butterfly.
Flower. Yeah.
Oh, okay.
Yeah. Plant sitting behind there. Good. Is that better?
Yeah, it's out. That's okay. A lovely plant.
Yeah. We got it sitting on the table here. Yeah. Mary Johnson, you ready? It is 7:01, and we got 12 participants, and hopefully it start growing. But like I said before, we're gonna show this over and over and over. Hopefully, more people will get to see it.
Appreciate you doing it.
Oh, yeah. Yeah. You gonna get started?
Are you ready for me?
Yeah. Let's go ahead and start. I hate being late.
Okay, well, first of all, let me say good afternoon or good evening to each of you, and what an opportunity we have tonight to come together. Let me thank you, Lawrence, for bringing this together. Some time ago, I met you, and we came to know each other during the census and the get out to vote. So from that relationship, we began to chat, and just a couple weeks ago, which this is fast to get this together, you and I had a discussion, and you asked me about the opportunity for us to conversate in Orangeburg about COVID-19, its impact and such. And I kind of thought about that thing. I said to you that I'll do what I can. So from there, we began to chat about who we'd get and what we'd talk about. But let me thank all of you that have joined and those that will come to join. I don't know that we'll ask all of you to say who you are now, but at some point we'll give you an opportunity to ask questions. As I hope that we can wrap this up in 45 minutes or so. But as we go through, it is my intent that the group that we brought on, and we do have some people that can really talk to us about everyday life and about things far beyond. As I look back over the last 7, 8 months, I've spent a lot of time as a mayor of a small town, William Johnson. I've been the mayor here for in my 12th year, a small town, and I've had the opportunity to be the mayor of a rural town. So as we talked all over the United States about COVID-19 and the impact, the effects, and all the things that went on, I've had the opportunity to be updated from the White House. I've had an opportunity to be updated from NAACP, joined a lot of national conferences and such. But the one thing that I've not had an opportunity to do is to sit down and talk among those people here in Orangeburg County, a little rural town, and how it affects and how it impacts us. So this gives us an opportunity today to talk to those things. But I want you to know that we will not say that we come as authorities and have all the knowledge, but we can have a good conversation. Just to know that the people that we have joining us tonight include such as the Honorable Representative Gilda Cobb-Hunter, Harold Young, Administrator of Orangeburg County. Erica Brown will join us, and I'll tell you just a little about Erica. Erica has fought hard to make sure family practice, family health centers have a presence, and they test here in Holly Hill every week, so we're grateful for that. So hopefully she can talk to that point. Now and I'm missing one, is Dr. Jane Kelly from DHEC. I hope that she has joined us too. Thank you, I see that you've joined us. Now, to make this, I guess, more of a little rural chat, a conversation, a discussion, I wanted such that we did not say to Representative Gilda Cobb-Hunter to talk about this. We didn't say to the others to talk about that. And we really want you to be open to talk about things that you think affect us as we go into this holiday season. It was very imperative that we get this done prior to the holiday season. So we may have missed some people and missed some things that we'd have done differently if it had been more time. But from a small town, and I'll hush when I get this piece, it amazes me how the day-to-day operation of a small town and how we sometimes find that we are so caught up in what used to be until we cannot adjust to what is today and make the best of it. In our small towns around Orangeburg County, we have 17, for those of you who may not know. We find ourselves struggling with the challenge of how we get people back to the parks, how we get them to venues, how we get them to schools, how we get them to the offices and all. And so at some point, the county thought worthy of, and I'm sure that Harold will talk to that, of making sure that we do the very best we could to minimize the risk of the COVID virus. So there was a face covering ordinance that most of the towns in Orangeburg decided to adopt. And that was really hard, and it still is hard, because people really don't want to be told what to do, and they said we tell them what to do, so we deal with that piece. It's so many challenges that we have to deal with. But at the end of the day, as we have looked the last 7 or 8 days, cases in South Carolina has been over 2,000. And today, as I looked at the numbers, and the numbers very specific for Orangeburg, we have 55 cases today, and that's probably the highest cases I've seen. The neighboring county, Dorchester, has, I think it's 61. Those are some high numbers. So it's very fitting tonight that we talk through this conversation. Again, let me thank all of you all for coming on, and be reminded that the holidays are coming up. If I don't get back again, let us be as safe as we can and do all the safe distance and all that we'll talk about tonight. I know all of us miss our churches, we miss schools, we miss all of these things. But again, thank all of you for coming on. At this time, I'll kind of back off, and Lawrence, you can direct who you want to be first, and I'll be fine with that. Do you hear me, Lawrence?
Now I got it. I had to unmute myself. I'll go ahead and get started. Yes. But first, I want to make everybody aware. Senator Vernon Stevens was invited to be here, and he wanted to be here. I had promised him I was going to make everybody aware of the fact that he had a prior engagement and that he couldn't get out of. Governor had all the new legislators down there today, and it started at 6:30, so that was definitely unable to do both. But he does want everybody to know that he wanted to be with us. The other thing I want to make sure I say before we get started is that, I think this is an opportunity. It should be done more often and regular to make sure that everybody's voice is heard. It's an opportunity, that grew out of the virus, that we can meet and discuss things and not leave our home. So we have opinions, and it's important that everybody get an opportunity to voice those opinions, and hopefully those opinions could be for the good of all. I want to go ahead and get started, and we'll go with Representative Gil Carr-Punter, and then we'll go to the City Administrator Harold Young, Ms. Erica Brown, and then Dr. Kelly, and then we'll have a question and answer period. But please, I sent out a notice earlier today. If you could keep your opening statements between 3 to 5 minutes, I would appreciate it. And that would give us enough time to give, right now we got 15 on the call, so it's another 10 people that may have want an opportunity to voice a question and get your response to. So thank you, and Gilda, please. Thank you.
All right. Hey, everybody, and thanks, Lawrence. And I noticed you said that time limit when you were getting ready to talk to me. You letting everybody know how far back you and I go. I
Right,
do
that's
talk,
true.
but I'm going to be respectful of your time limit, and just join in the mayor and thanking you and Carolina for pulling this together. Y'all have been really good about coming to the eastern part of Orangeburg County, and I see William Christopher is also on the call. The mayor mentioned the activities that y'all were engaged in down there during the general election, and I want to just publicly thank you and your team for the work you did in Vance and Holly Hill and the Utahville area. Much appreciated. As far as COVID-19, I really wanted to just let everybody know this virus is real. There are people who are leaving here every day. The mayor mentioned the holiday season, and quite frankly, what my message is, everybody's excited and very hopeful now that we have a vaccine, but I'm sure the people from DHEC will share with you that the fact that we have a vaccine doesn't mean we need to let our guard down. Unfortunately, we've not had a lot of leadership from the federal level, very little from the state level. There has been leadership. Orangeburg County passed, and I'm sure Mr. Young will talk more about this, passed a face mask. Some individual towns may have, but it's been such a hodgepodge of regulations or non-regulations. And so it's been real hard for there to be consistency. And what that has resulted in is the virus is winning. There are a lot of people who believe that wearing a mask is whatever, pick your word. But I really just want to emphasize the importance of the CDC guidelines of wearing a mask, of washing your hands, of practicing social distances, particularly with the holidays coming up. You know, we are all interested in being with family, socializing, and all of that. And quite frankly, a part of the problem we have here in South Carolina, the numbers are surging. The positivity rate is over 20%. That means we're not doing a very good job here in South Carolina of containing the spread. We have got to look in the mirror and decide that life is worth living, and that wearing a mask is not just for you, but it's also for the people you come in contact. So I want to encourage everybody in the sound, under the sound of my voice, to please continue to practice social distancing, to wash your hands, and to avoid crowds, and to not congregate. In our community, a lot of times, particularly with the deaths we've seen as a result of COVID, we want to have, as we say, the setting up and all of that. I just, again, want to encourage us to recognize that there are going to be more Christmases to come, more birthdays, more Thanksgivings. And if we sacrifice now, we'll be able, hopefully, next Thanksgiving to have a healthy Thanksgiving, like with all the trappings, and Christmas and all of that. So it's not over. It's not going to be over. We will still have to talk about the distribution. And Lawrence, perhaps Carolina for All will work with the mayor, myself, with Mr. Young, in pulling together conversations once we know how this vaccine is going to be distributed. We are really going to have to work with our partners, with Family Health, with DHEC, with RMC, with MUSC, to make sure that we encourage people to take the vaccination, to get vaccinated, because there's a lot of mistrust, and particularly in the Black community, about this vaccine because of our history. And I won't go into all of that, but there's much work to do. I am willing and able, and just very grateful for y'all for doing this. Count on me anytime you want to increase the awareness of this issue. And so thank you for having me, and I appreciate the opportunity and look forward to any questions y'all might have. Thank you so much.
Good evening, everybody. First of all, I'd like to thank you for having me here this afternoon and allowing you to serve as your county administrator. You know, COVID-19 was something that hit us hard, and every day in the meeting of the needs of Orangeburg County, we try to do that the best way we can. And with the various offices and various things we have to do, all of a sudden an unprecedented event jumped into the fray and was something that we had to deal with. What we began to do at the beginning of this was to collect data, move forward, and try to do things to protect our community, because with the information that we were given through meetings and memberships and coordinating with other leaders throughout the county, we knew we had to do something to protect our community. You know, 24/7 is a lot that goes into protecting the community in all ways and all facets. But at the end of the day, the virus is something that we've never dealt with, and it's hard hit. As Representative Cobb Hunter said, you know, we know for a fact that it's more crucial to our community because we're a majority minority county, and we have a massive amount of minorities within our county. So if the virus hit us worse, we know we have to protect ourselves and do what we can. As she stated, Orangeburg County very early on did a mask ordinance to help curb the spread because of what we were doing. And I would like to commend Representative Cobb Hunter, because when we started out, testing was critical and nobody understood what testing was. And through her help and leadership from other members of the legislative delegation, MUSC and get it started. And since then, Family Health Center has carried on the torch and done it so every day with DHEC and other providers. So we're grateful for that. Through partnerships that we've been working, Orangeburg County has had a consistent amount of testing throughout. It has slowed down a little bit here and there, but throughout the virus since March, we can say consistently we had testing going on throughout the county. We provided PPEs in the very beginning to all of the police departments in the 17 municipalities so that they could take care of their critical first responders. So we took the lead in this as far as getting a stockpile of PPE to help the hospital and the towns in the very beginning until everybody could get through the supply chains. Remember back in March, the supply chain was broken down. So getting PPE was very hard. And so we've done a lot of things by leading by example. When it was time to close the building, we did what we had to do, cancel events and led by example. We made testing available and we created plans so that we could deal with this pandemic. As Representative Kyle Hunter said, we're at 20-something%. Orangeburg County is 21.5% positive right now as of Tuesday. And that's high. That's even higher than it was when we were in March. And so if you look at it, when you look at the waves that are coming, you have the Thanksgiving wave is what created this spike. Christmas is next week, and then New Year's is the week after. We have some unprecedented times to come. So that's why information is key to what we're doing. And we appreciate you giving us the opportunity to let the citizens know that how we get through this is how serious they take it. We can only give you but so much information. And if you don't take it seriously, you could end up being in peril. So we appreciate this opportunity to be on this forum, and we look forward to any questions that may come. Thank you.
Good evening, everyone. I apologize. I'm having problems with my camera on my computer. My name is Erica Brown, and I'm the Assistant Director at Family Health Center of Communication Relation. At Family Health Center, we do COVID testing sites Monday through Friday from 9 to 3:30, and we cover the areas of Orangeburg County, Dorchester County, and Bamberg County, and Calhoun County also. At Family Health Center, we when we do the COVID-19 testing, we appreciate the mayor from Holly Hill because we goes there every Thursdays, and when we go there, they have a lot of accounts. They see over 100 people, every time that we go out there, and we really appreciate that. And when you come to the COVID testing, there's no appointment necessary. It's free, and we ask every person who comes to bring their driver's license or a valid ID, and the person, the child must be 2 and up. And for the and we also want to make sure everyone wear their mask, and we have our staff, and we make sure everyone wear their mask also. And you'll get your results back within 72 hours. And how we follow up with the patients, we will text them, or they can go onto our online portal and they can get their results like that. And also we give the patients, when they do the testing, we give them masks and hand sanitizer and literature about COVID-19.
Okay, thank you, Erica. Brown, thank you, Mrs. Brown. Were you finished?
Oh, yes, I was.
Okay, Dr. Kelly?
Thank you so much. I did prepare some slides. I know we've only got a few minutes, but yeah, is that okay? Could I share my screen?
Yes, that's fine.
All right, let's. Sorry, it takes me just a minute. I keep getting a message says host disabled. Oh, so that's okay. So I should be able to. I'm sorry, I don't understand why I can't share.
Yeah, and I'm not, and I don't know. I'm sorry. Share screen. Let me see if that helps. I got help coming. Hold on one second.
All right. Meanwhile, not to waste the time, I mean, let me applaud Orangeburg County for a mask mandate,
Yeah.
because that makes a huge difference. And that's going to be part of my talk as well. I just want to give you a couple of visuals for, you know, how important a mask mandate is. But, we can, oh, maybe I can do it. Hang on. Well, even if I can't do the slides, that's okay. I can always send them to you later on. Basically, what I was going to show you in the slides are some of the things you already know. What does it look like for the United States as a whole? Well, COVID-19 cases, deaths, hospitalizations are increasing everywhere. And unfortunately, they're increasing everywhere in South Carolina as well, especially in the upstate regions and Midlands. And it is a disease that is not an equal opportunity disease. There's no biological reason for this to be true. But as I'm sure you're aware, COVID-19 kills Black and Hispanic Latino people 3 times as often as white people. And that's adjusted for age. This is not a matter of, older people getting sick. It is a matter of maybe some other medical conditions like diabetes or obesity, but I'm sure you're all acutely aware it's also access to care, getting diagnosed early enough, getting the appropriate treatment. And that just makes it me feel all the more urgent about helping people make informed decisions about whether they want to get vaccine or not, understanding what the issues are around the vaccine. Now, I have some good news. Just today, the second COVID-19 vaccine was approved. That's the Moderna vaccine. The two of them are really very similar. And I just want to say a couple of words about how they are made and that feeling of how could these vaccines have been made so fast and still work and be safe. I think it's a mistake to think of these vaccines as just being made just this year. The biggest step in making a vaccine is the basic science research, understanding the virus, how it works. If you were going to make a vaccine, what part of the virus would you make the vaccine to? Do you remember SARS, severe acute respiratory syndrome in 2002? It hit about 8,000 people, killed about 800 people in the world. And so science was beginning work on a vaccine right then and there. And then the virus was contained. So they stopped working on making a vaccine, but they continued that basic science research. So we've got 17 years of basic science research on the genetics, the molecular biology, all that detailed background, so that when SARS-CoV-2 was first hit and its genetic code was announced January 10th, scientists already knew what they wanted to do. Because they had 17 years worth of research on this. So they immediately started testing a vaccine in mice, in monkeys, and they could quickly move into human studies. I do want to emphasize, this has been really fast, but no steps have been skipped. The longest step is that basic science step. They were working on it already for 17 years. Now, what about those phase 1, 2, 3 studies? What does that mean? Those are where they start trying the vaccine out in humans. Phase 1, they take young, healthy people and they give them the vaccine just to look for, are there side effects we need to worry about? If it looks okay there, then they move into what's called phase 2 studies, where again, they give it to a larger group of people, like maybe 500 people, to look and see, again, are there any safety concerns? Does this vaccine look like it's going to work? And if things look good, they go into phase 3 studies. Now, here's another place where this vaccine is different from vaccines that have gone on before. Usually when a pharmaceutical drug company makes a vaccine, they take their time because they don't want to waste any money. They take years bringing people into those phase 3 studies because they want to do it slowly, not for safety reasons, but for budget reasons. They don't want to spend money if a vaccine's not looking good. Instead, for both Pfizer, which it was approved back to, a week and a half ago, and Moderna, for both of them, right from the beginning, they recruited over 40,000 people. They invited people, volunteers, over 40,000 people to join in these studies. So both of them have been tested in more than 40,000 people. There were no serious adverse effects, no serious side effects. There were lots of mild to moderate complaints. People had soreness at their arm. They felt fatigued for a day. They had a headache for a day after receiving the vaccine. Those are inconveniences. I don't want to minimize them because some of those people, basically they had to take the next day off from work. But that's a sign to me that the vaccine is working. I don't know if you all have ever had the shingles vaccine, but I took the new shingles vaccine. It's 97% effective, but it comes with more side effects. But I'd rather have that than have the old shingles vaccine that only worked half the time. Yes, it meant that I slept late the next day and felt achy all over, but that's better than getting shingles in my mind. To return to these COVID-19 vaccines, the good news is that both of them are approved. We in South Carolina have the Pfizer vaccine already starting to roll it out. The state got 42,000 doses of that vaccine. Now that's not very much compared to the state population, but it's a start. And we've been told that we will get weekly allocations, weekly amounts of new vaccine for the Pfizer one, and probably starting, now that Moderna is approved, starting probably Christmas week, that we will start to get shipments of the Moderna vaccine. We're supposed to get about 200 to 300,000 doses before the end of the year. Again, that's not much for all of South Carolina, but as they rev up manufacturing, we will get more and more doses. Some of the important messages I want to get out to people are ask questions. You should be skeptical of vaccine. And I'm not even talking about your historical trauma. I think, I'm aware of some awful things that have gone on with government, with drug companies, with experiments and studies that were unbelievably unethical in the African-American community. I think a number of things have been put in place to prevent that with human studies reviews and institutional review boards. But nevertheless, I think every individual has to weigh for themselves. What's my risk with, of getting COVID-19, or if I get it, being severely ill, versus what's my risk of some side effect from a vaccine? There are rare side effects that occur with vaccines, right? The 1 in a million side effect. We don't even know about those yet. Vaccines have been given to tens of thousands of people, but not millions. There may be some things that come out only after millions of vaccines are given. CDC, FDA, and DHEC, we will continue to look for people reporting any side effects so that we can look for clusters in case there's some unusual thing that nobody predicted, nobody saw before, comes out, so that we can look into that and try and figure out, are there some people who maybe shouldn't take the vaccine because they've got some medical condition? None of that came out in the phase 3 studies. They had no serious events and they had no serious allergic reactions. But we know now that we're getting lots of vaccine out there, occasionally an allergic reaction can occur. So we want to be prepared for that by having epinephrine available, by having people who are medically trained giving the vaccine. I want to leave time for questions. Certainly, my 5 minutes, I bet, is up. I want to put in one plug though, and that's for the flu shot. Because even though Pfizer vaccine and Moderna vaccine may not be in your neighborhood yet, you may not be able to get it yet, you can get the flu vaccine. And I'm very worried. We're not having a bad flu year thus far. I think the fact that people are wearing masks and staying away from each other has gone a long way to prevent bad influenza year. But being infected by COVID-19 and influenza at the same time, that would be bad. We are seeing cases of that in other places in the country. So I know the flu vaccine is not popular, but I got my flu vaccine. I think this is the most important year of your life to get that flu vaccine, because if you get flu, it'll lower your resistance to getting COVID-19. We know that happens. So I'm just gonna finish with that. I do have slides and maybe I'll send them to you later. You can take a look at them on your own. Thank you.
Yeah. Thank you. I appreciate that. We're gonna go to a question and answer period. And I'm trying to figure out how we, well, I'll give the first question, but we're gonna have to, and William, if you're on the call, if you can, if you have any questions in the chat, could you read them for me? But, in most cases and situations that our community have to confront, you got a situation where you got policymakers, and then you got people that activate the policies in the communities. I got a question concerning, and I talked to Mayor Johnson about it earlier, about the situation we are with the vaccination. And I understand that the vaccination is also create opportunities in other areas besides just health. It's going to create opportunities in the economy. So I'm concerned about making sure that grassroots people, everybody in the community, get opportunities. I see the situation like at stores like CVS or Walgreens as a way for a young person to reach out and learn something that they may have not had any experience in before. They hiring more people to do these, to give the shots and everything. And I was wondering if anybody can address, is that going on now? Is CVS and some of the private entities, is Department of Health in Orangeburg, are they hiring new people right now? And I'll start with Gilda and then Mr. Young, if you could answer that.
Oh, Lawrence, I'll try and a part of your question, I didn't hear all of it, but I think the gist of it was what kind of economic opportunities might be available as a result of the vaccine.
Right.
And the answer is I don't know, because one of the things that is still kind of going on is, and when I say I don't know how that would translate directly to us here in this state, because we're not manufacturing the virus. I would imagine from a delivery standpoint that there may be opportunities with UPS, FedEx, or whomever. And the doctor didn't mention it, but one of the things that I noticed about the differences in these viruses is that the one that was approved today by Moderna doesn't require the kind of cold storage and all of that the Pfizer vaccine has required. So I'm guessing that if you run, I'm assuming they're saying that the people who make dry ice are seeing a real increase in their business. One of the areas that separate and distinct from the vaccine, though, that I think there are employment opportunities is in the area of contact tracing. And contact tracing, which is what DHEC and I'm assuming Family Health and a whole lot of other people who are involved in this whole coronavirus work. Contact tracing is critical and is important because that's how we contain the spread. Now, and just putting on my legislative hat, there were a lot of my colleagues who just quite frankly didn't understand what contact tracing meant. And they saw it as some kind of violation of privacy and all of that. But, and again, I don't know, there are others on the call who can speak to employment opportunities as far as being hired to track down people who have been exposed or may not know it. But as far as the vaccine itself is concerned, Lawrence, I'm not really aware of any employment opportunities in that regard. Not that I'm aware. I'm sure there are some, and outside of the delivery chain, I just don't know here in South Carolina where those opportunities might be.
Thank you. Mr. Young, do you want to address that?
I agree with Representative Cobb Hunter. It's not many opportunities outside of the supply chain. But one of the things that we, needs to be taken advantage of is the fact that I think is some parts of the nursing component of the education has been relaxed to do a lot of that virtually. So that is a huge opportunity for a lot of our local citizens who have been in the path of career change or trying to finalize opportunities in the nursing field because of the way they're trying to get people to help on the front lines with the virus. So sometimes you have to look at the bigger picture on certain instances. And I think that's a situation where that's the biggest opportunity out of the whole vaccine and the situation we're dealing with this.
Thank you.
Lawrence.
Yes.
Somewhere I would like to hear Harold talk to the point of the COVID vaccines as it applies to Orangeburg. He talked at some point about how they come to Orangeburg. I think he could be brief with it and tell us what our expectation as to who gets them first and some kind of timeline at some point. I don't know how you want to put this in, but I would love to hear just him briefly tell us what we can expect.
Well, really, we're really trying to get involved with that and trying to get everything up and going on our end. As you know, we had a meeting yesterday with the 17 municipalities to try to help coordinate those agencies that municipalities that had people that would be considered first for the vaccine, i.e. their public safety components and the people in the front lines of that as well. So we're in the process of setting that up. We have to have a doctor or a nurse or a pharmacist, I think, is also available to do that, are the only ones that can give the vaccine. And so in our case, we have doctors and nurses on our staff because of the detention center that are going to do the vaccines for our first line people. And we offer that, as you know, to the 17 towns who have people that are considered in this first phase. You have to make a request to DHEC based upon your phase of how many people you feel like you need to vaccinate in the phase, and then they will make a determination of how many vials you get. Once they're delivered to you, they have to be used within 5 days because that's the only, they can only be refrigerated under the sub-zero category for 5 days after it's taken out of that under 72 degree below cryo freeze. It has to be used within 5 days after that. So they will only send you as much as you need and can vaccinate. Now, one key thing that has not been said, as well as these, both Pfizer and Moderna are both 2-part vaccinations. So you get the first one and you have to wait 3 weeks later, and then the second dose is, and you cannot mix the dosage. So if you get Pfizer first, then you have to get Pfizer for the second dose. If you get Moderna for the first dose, you would have to get Moderna for the second dose. So that is something else that complicates that. But keep in mind, like Representative DHEC and Representative Carl Hunter, vaccination process, if we're talking about 300,000 by the end of the year, Greenville County has 500,000 people by itself. So that's not even vaccinating Greenville County by the end of the year. So it's for the virus to make its way throughout our community, and we have to still practice social distance and wear our masks, use our sanitizer, because that is the key to this battle and the key to this fight until we can get everybody else vaccinated to a higher level. And right now we're at a 21.5% positive, and at the end of the day, that is higher than it was at the beginning of COVID back in March. And I think Mayor Kim is over.
We would just like to remind everybody to make sure that you're muting unless you're speaking. Thank you.
Okay, Mr. Young, did you finish?
Yes, sir.
Okay, good. Yeah, I'm sorry. I was getting some background noise. I hope everyone was able to hear you. Is it anyone on would like to ask a question?
I got one for Harold.
Okay.
Harold, I'm the general resident. What can I expect in terms of getting this vaccine in South Carolina?
As far as the regular public, if they're not on any of the first phase or second phase, probably won't see it till the second quarter of 21, if that, maybe even third quarter.
Okay.
And that's why, here again, how we survive COVID-19 as a community, as Orangeburg County, is indicative of people wearing the mask and doing what they're supposed to do. There's going to be stories that'll be written behind this whole thing. And I can tell you, and Representative Carl Hunter knows it well, when we first started finding out how devastating this thing can be, there was a situation because, you know, we are over EMS, where we ended up having a situation where a person got sick from one event and it was a cluster of people before we even knew to do what is the norm today. Like all the funerals and stuff that are being done graveside, unfortunately, we had to learn that through a situation that we had, and we saw how COVID could devastate a family. In the very first part of this virus, there was a family that lost 4 or 5 members right here in Orangeburg County in one family to the virus. And that tells you how serious it is. And so it does everybody different. We've heard of people with pre-existing conditions that have been on the ventilators or did not survive. And then we've seen people who've been healthy as a horse end up in the grave. So it's nothing that you can take for granted. And we're doing all we can to lead by example. And so what citizens have to understand, there are going to be time periods where government has to inconvenience you for your own safety. And when we have to shut down buildings and augment meetings and go virtual, that's for the safety of the citizens. And how you come out of this is how your leadership basically takes a stand on what they needed to do. The mask ordinance was not popular, but we stood the line and we did it, and we will renew it. Well, council has the opportunity to renew it. Let me back up because my bosses have to say so, but it'll be presented to them again for renewal. And I feel like they would do the right thing, but that goes a long way in help keeping our community safe.
Thank you. Thank you. I wanted to ask Dr. Kelly about schools. Do you think schools in Orangeburg can be safe in January?
I'm glad you asked that question. I want to piggyback on the discussion around masks because I think that fits in there as well. You know, masks, I know they're unpopular, but masks do work. And I feel like my favorite example is the one of the 2 hairdressers who were, it was before they developed symptoms, but they were infected and contagious. And they served 139 different women in this hair salon. But they required everybody to wear masks. So they wore masks, those women all wore masks. And 2 days later, they tested positive and they had to go back and contact all those clients to say, you know, you may have been exposed, please get tested. Do you know not a single woman, 139 women, 2 hairdressers, you know that they're standing closer than 6 feet apart. You know that they're talking to each other for more than 15 minutes, not a single case of transmission of virus. I mean, I think that's a really compelling story. And answer to schools, schools are actually doing quite an amazing job keeping students and teachers safe. And one of the slides I was going to show you, and like I said, I can send you these slides later on. One of the slides I was going to show you was of a study done in Mississippi that looked at kids who were in virtual school versus in-person school and who got COVID-19. And it was only the students who were participating in other outside activities, funerals, you know, family gatherings, you know, funerals or birthday parties or weddings, other events where they got together in groups. That's what really made the difference. So the school environment itself, I think schools have gone a long way to try and keep it as safe as possible. The risk is not so much in the school environment, it's what's going on in the community and community transmission. It's what the kids do, not only what they do when they're out of school, but what their other family members are doing when they're not in school.
Thank you. I have a question for Mrs. Brown. I want to know if you felt that the majority of the people that needed testing are getting tested, and if not, what is the why is that the case that they're not showing up?
Okay, you mean like if the people not showing up to get the COVID-19 testing?
Right, that's right. Yeah, are y'all having a robust, you know, with the numbers as high as they are, in not just in South Carolina, but all over our nation, so people understand there's a lot of virus in our communities. Are they coming out, or are they just only coming out when they feel sick? You know, is my question.
People are coming out when they have, like, some people come out, they have symptoms of it, and some people just come out just so they can make sure that they safe Cause you have some people come get it taken like every week.
Oh, the same, okay. And is the number of people you testing is just as high as it was in November?
After Thanksgiving, it got up real high. When we first did it and we did it with the county of Orangeburg, we had it was a lot. Then it went down. The numbers was up like in the hundreds at time it went down. Then after Thanksgiving, the numbers went back up higher. And today we saw we have two teams, so they saw over like 200 today.
Lawrence, may I respond to that as
Oh,
well?
yeah, please. Yeah.
In addition to what Ms. Brown has said is happening locally, statewide, I would suggest to you that we are not testing as many people as we need to. For some of us in the General Assembly, our concern has been since March, the level of testing and the number of tests that were given. And of course, not all of that can be put on one entity. It's not DHEC's fault that people are not getting tested. And that's why programs like what you're doing now is so important, because you have to keep in mind that since we've known about this virus since December of 2019, it really got cranked up in February of 2020. But because there is has been so much misinformation about this, because people are not convinced that it's real, and because there are people who are what we call asymptomatic, meaning they don't really demonstrate any symptoms or anything, we've not had, in my opinion, we have not had the amount of testing in South Carolina that we need. The other thing I think is important for the people on this call to remember is that you can't just test one time and think you are good to go. This virus, because there's still a lot of uncertainty about the transmission, of course, there's a lot more knowledge now, but you still need to be tested more than once, particularly if you have been around somebody who has the virus, or if you have been exposed. And again, I keep talking about the contact tracing. That's why that's such an important part of this work, because there are a lot of people who are asymptomatic. I would just encourage people to recognize a couple of points. One, we are still with some dark days ahead of us as far as this virus is concerned. This is no time to let up, to let our guard down. We still, if anything, we need to be more aware of the importance of wearing a mask, because we're going indoors, the weather is turned colder. And so all that we have seen and read about this virus says when you are in closed spaces and all of that, the chances for the virus to spread is greater. I would just say to you that this virus don't care who you are, how much money you got, how much money you don't have, what color you are, none of what political party you are, none of that is important. What is important is protecting yourself and your family and your loved ones. And it means sometimes being assertive, because people in stores, because we're starting to relax, and because there's not been leadership. Again, leadership from the federal level, leadership at the state level has been none from the federal level, hit or miss from the state level. There is legislation that Representative Wendy Brawley and I have filed, which will mandate a mask statewide. People don't like it. We personally don't care. But we just got to be serious about this. So I didn't mean to ramble, but no, there has not been enough testing done, and probably never will be enough testing done, because there were a lot of people early on who thought that testing made our numbers look bad. And so there's never been a robust appetite for a whole lot of testing. So I'll just stop at that and let somebody else.
Okay.
Lawrence, would you let someone that is called in maybe ask a question now?
Yeah, please.
We got a few more
If someone
minutes.
have one, can I get someone? All you got to do is unmute yourself.
Hello, can you hear me?
Yeah, we can. Please, thank you.
This is Betty Pels. I have a question. I think I heard that there is a plan to get everybody vaccinated that wants to get vaccinated in Orangeburg County. But what I want to know is, what is your plan to communicate your plan to the people? You know, like who will get it first, who will be next in line? Have you communicated that, or do you have a plan to communicate that to the people? Because I think people are anxious to know when will be their time.
Harold, would you talk to that?
Who is that now?
Harold.
Yeah, we do have a plan, but the problem is the vaccines are now rationed by DHEC to these areas. So the first line people are healthcare workers and first responders are the only ones who will be getting it first. Then after that, it would be nursing homes and elderly and people with pre-exist or major conditions that are hospitalized. So it's a process before it will get to the point that the regular public will be able to get the vaccine just like we do. We talked about that today with the 17 mayors. So we discussed our plan with the 17 mayors throughout the county. And once we get to the point to roll that out, we will probably end up, once it gets to the level of vaccinating every day and everybody, we will set up sites just like we're doing with the testing sites. And there'll be some vaccination sites here and there. Now, I do know on the federal level, there is a strategy once it gets to the mass testing of everybody. They have I think they've made a deal with CVS and Walgreens because they felt like there was one within so many miles of everyone in the country, but clearly they haven't been to rural Orangeburg County. And so we're going to have to fill in the gap as a county, and we're prepared to do that. And we will be pushing that information out in the near future. The problem is right now we can't push information out because we're only doing the ones who are approved for phase 1, and then right now that's just healthcare workers and first responders.
Availability is not there.
Yeah,
Great.
I have one more question.
Go ahead.
Okay. Will Orangeburg County have something like a website or hotline where if people have questions about this vaccine, they can call in and get those questions answered, or maybe go online and ask those questions and get them answered?
The vaccine questions are medical questions, so we would have to yield that to DHEC. We wouldn't be able to answer those. That would
Okay.
be a DHEC.
And if I can just say, so we have a frequently asked questions, an FAQ site, and we're adding to it daily. So if you just Google DHEC COVID vaccine, it'll bring you to those FAQs.
Okay, thank you.
Now, we do have informational sheets that we will be putting on the county's Facebook page and social media fairly shortly that talks about what to expect from the vaccine and things of those that we received from the national government, from the Pfizer company, that detailed the virus, the background, the effects, and things of that nature. So we will be posting those in the next 2 days.
Okay, thank you.
All right.
Lawrence, can we do one more question and then kind of wrap up? Thank everybody.
Yeah, I agree. I think we got 5 minutes left. So is there anyone else that has a question that's on the line? Better hurry. Well, do anyone have a question? Okay, hearing none. We're gonna go ahead and wrap up. And I want to tell everybody how much I appreciate y'all taking time out of y'all evening to address a community concern that's very important, that we talk to each other. It's very important that we give them information to one another. So I would ask everyone, this video will be posted on Carolina for All website and also on Carolina Fall Facebook page. You can reach the Facebook page by just typing in Carolina Fall. And with the website, I think you have to put www.carolinafall.org. Thank you again. I want to ask all our panelists if y'all have one last thing to say briefly, that you definitely need to do it now.
I'd like to say one last thing, and that is,
Okay.
I had said each of us have to make our own decision. This panel tonight, you've been incredibly articulate about all the public health measures that are important. But I know that people in the community have many questions. There are many rumors going around. There's a lot of misinformation out there. And the more we get feedback about what questions people are asking, the more we can help answer their concerns. But I would just advise everybody, it's a personal decision getting a vaccine. I weigh my own risks and benefits, and I have no doubts what I would do. But I would ask that people make sure they seek credible sources. Like if somebody posts something on Facebook and you say, well, where'd you get that information? And they just point you to another Facebook page, that's not credible information. I mean, even when I read a newspaper article, I want to know, well, did that come from a study, or that's just a hearsay? So thank you so much for having this session. Word of mouth is so important now for people to understand so that they can make informed decisions.
Thank you. I appreciate you taking the time this evening. Anyone else?
I would yield to the representative.
Oh, go ahead.
That's kind, Harold. I was letting everybody else say. I really appreciate the opportunity. Love the open conversation. Just remember, we talking about vaccines. It's going to be in response to Ms. Pelz's question. It's going to be way in the summer before we even get around to moving beyond frontline workers and first responders as far as the vaccine. Because keep in mind, it's being manufactured. Anyway, just keep wearing your mask, keep practicing social distancing, and keep getting tested, and encourage everybody in your family to wear a mask, even children. And the way to wear it is not under your nose. It's got to cover your nose, cover your mouth and your nose. Lawrence, thanks again for doing this. Really appreciate the opportunity to hear from people and to share some information.
Thank you, Representative Gilda Cobb-Hunter. And thank everyone else. Mayor Johnson, do you have anything else before we close?
I'll be quick. Let me
Okay.
just thank all of you all for coming on, and your time was well spent. And certainly this is the start of a conversation we'll continue. So again, thank you all, and we'll talk later.
Thank you. Y'all have a good evening.
Thank you.
Thank you, everyone.
Happy holidays.